Welcome to the Polymer Science Podcast. I am Dr. Alicia Buertes.
And I'm Jacob Shackman.
In this podcast, we'll be speaking to researchers from around the world and talk to them about how their work is improving our daily lives. I hope you enjoy our conversation and that you learn something new.
Hello and welcome back to the Polymer Science Podcast. I hope our listeners have had a wonderful start to their year in 2023. I want to thank you all so much for sticking with us after our hiatus these past few months. As I'm sure we're all familiar, life can be a lot sometimes, but it's not always a bad thing. For example, I'm putting my nose to the grindstone to finally graduate with my PhD this winter. Can you believe it? I can actually. I'm really proud of myself, thank you. And my co-host, Dr. Alicia Buertes, has some very exciting announcements of her own. But you'll have to wait until our next episode to hear those. Those are for her to tell. But trust me, they're exciting. In the meantime, please enjoy this interview.
Our guest today is Dr. Tristan Clemons, assistant professor at the University of Southern Mississippi. And I actually get to be with him today. Dr. Clemons is sitting right in front of me. Dr. Clemons, how you doing?
I'm good. Thanks for taking the time. And it's been a while for us to try and make this meeting line up. So
it's gone back and forth, some rescheduling. We got this down now. I'm grateful. Thank
That's
you for your
That's a great intro.
time.
I love that.
Yeah, good. All right. So let's have our listeners get to know you a bit. One thing I like to ask all of my guests on the Calendly invitation is, what made you happy today? What are you grateful? And you said you're grateful for your students' hard work and getting good results.
Yeah. So I've recently been an assistant professor, right? So it's been 1 year, almost 1 year, 1 month to the day. Just the way we run our students here at USM Polymer Science is they have that common first year where they get all their coursework at the same time. So it's only really been the last 3 to 4 months where I've actually had a couple of grad students now in the group, and it's really made the journey feel real, because now it's like we're troubleshooting problems, we're getting results and seeing how things are going and sitting with the students and working that out. And I just remember that day you sent the invite. We got some kind of nice results on one of our projects, and it was just, that's why I'm here, and what I love is being able to work with the students. And it was just a moment for me to reflect. Thanks for asking the question on what was nice that day, and that was it.
Yeah. Is this your first time setting up a lab?
Yeah.
Talk a little bit about that process. What was new? What hit you in the face that you didn't really expect?
So lots of things that I wasn't expecting, and that's the game. Definitely first time setting up the lab. One thing that caught me off guard was I took over a lab space that had a previous professor in there for 30 years, pretty much. He was in the building the whole time since it's been here. And I think when he left, he just dropped the mic and said, "See you later," right? And so glassware, chemicals, and everything else was all left in there. And I was on, young and naive sort of assistant professor coming in. The department said, "Hey, we left the chemicals in here thinking you might be interested because you're doing similar types of chemistry." This is Charlie McCormick. And I'm doing similar types of chemistry. So I'm like, "Oh, that's really nice of you. Real generous, But didn't quite realize that it's been sitting vacant for about 2.5 years before I came down here, which meant all the good stuff has been pillaged, right? I used to be a grad student, so I know how that operates, right? So all the good stuff's left, and I'm just left with the things that have to be, carefully cleaned out. And that took longer than I expected, for sure. But yeah, no complaints now. I mean, that's part of the game, and up and running. The other thing that was hard, obviously I started out of the kind of real COVID sort of lockdown period, I guess. But still, issues with supply chains that everyone's hearing about. That stuff's still real in terms of just getting equipment and things like that taking time. But yeah, I mean, I'm not going to complain about that. People are doing worse off for sure.
Admittedly, I probably took one of those chemicals.
Yeah, no doubt, man. Yeah, exactly. I want that back from the inventory.
All right, so let's get to know you a little bit more personally. So you're here at USM. Let's go in reverse order. Actually, no. I want to start a little bit from the beginning. Tell us where you're from. How'd you get started in, we'll say, polymer science? Yeah.
Okay. So I get this question a bit, and so where did I begin? First of all, I grew up in a small town called Bunbury in Western Australia. So pretty much, if you think about what Australia looks like on a map, we're in the far southwest corner. Most people, when they think about Australia, are thinking about sort of Brisbane, Sydney, Melbourne, down the east coast, and Perth, the capital city out in the Western Australia, is out to our side on the total other side. So it's kind of like the equivalent of Los Angeles versus, New York being on the east coast, right? So I grew up in a small country town. My parents own farmland, and so we have beef cattle and take hay off and things like that. And so I think my interest in science maybe just came from being pretty inquisitive. Like I was the kid that was always asking questions of like, why does this happen and what's that about? Annoying my dad pretty much about, trying to get answers to those things. And when it wasn't my dad, then it was my science teachers, right? Trying to figure that out. And so that was where I began sort of getting interested about science. And I love just figuring out how things work, right? That kind of really is what gets me going. I think about polymer science. I think the reason I'm in polymers and what I like about polymers is obviously the natural connection to biomaterials. And I really like the idea of tissue regeneration, and that's a big focus of our lab now. But why did I get first excited about polymers? There's two answers really. The first one is that it's probably one of the quickest ways to go from something very small to having something in your hands, like as a material product that you can kind of play with and do something with, right? So in a matter of seconds, minutes, you can really have some material, right? Something that scales. So I love how polymers scale so quickly. And I also am not a good enough chemist to be doing like medicinal chemistry or like carbohydrate chemistry or something like that, right? So, I love probably the accessibility of polymer chemistry, especially when you think about some of the, control radical techniques and things like that I work a lot in our lab. That probably attracts me to it as well. But, and that's probably a thrust of our group too, is trying to help make these chemistries be more and more accessible, right? With some of the work we do interfacing with high school students and things like that.
Mm-hmm.
So, yeah.
Was your undergraduate degree, was there any polymer focus or was it chemistry? At what point did you go, it sounds like you started to learn about what polymers are and how they interested you. But at what point in your academic career did you decide, you know what, I'm going to study polymers probably for the rest of my life?
Yeah. So when did I say I'm going to be a polymer chemist and call myself that from a tag? Yeah, probably a year ago when I started a position in the USM Polymer Science and Engineering. No, I mean, I have always worked with polymers, but have never, it's funny because I'm now teaching, pretty serious polymer organic chemistry in the department here, but never took any polymer courses myself, like, official training in that space. All has been learned on the job during PhD, postdoctoral time and stuff like that. But, I've always, again, been enamored by what polymers can do and the opportunities they can provide, and truly believe that they're going to play a really important role in the next, 100 years. We just celebrated the 100-year kind of anniversary of the macromolecular hypothesis. And, I'm very confident that polymers are going to play a big role in the next 100 years of society. And so that's why I wanted to, put myself in this position and be in this department. And, I'm excited. One thing that I've found about joining a polymer specific department like we have here at USM is that I'm learning new things about polymers, right? And that keeps me excited. That's why I love academia, is that you just keep learning and getting exposed to new things and new ideas, and that's exciting. So
is there, I'm going to be ashamed, maybe I don't know, but you said 100-year anniversary of the macromolecular hypothesis.
Yeah.
Is there like a singular statement that represents?
There's a paper from Hermann Staudinger that was published, 1921, right? That sort of said, yep, this is the idea about macromolecular sort of, I think we can make polymers. It's written in German, that's the kind of point that everyone looks back to and says that's where polymer science began, right? Obviously, polymers have been around forever. If you think about biopolymers in the body and stuff like that. But, when we started studying them as a science, that's the point that everyone points to, I guess, or that paper, and they say that's where it began. So
awesome.
Yeah,
the inception of polymers as an idea.
Right? And what gets me excited about that as well is then you think about so that was just over 100 years ago, right? And the only reason I knew that, I don't want to make you feel bad. The only reason I knew that,
I do. It's too late.
is that I was part of some review papers that were around sort of celebrating, 100 years of polymer science. So I didn't know any of that until, I was working on these review papers, 2 years back. But the other thing that I find really interesting and about USM polymer science, and especially where we are right now, is that, we've just celebrated 52 years of history of polymer science here at USM. And you think, well, that's amazing, right? That for half the life of polymer science as a science, USM has had a stake in that game, right? That's kind of cool.
That is cool.
And so I'm always impressed when I think about that we're pretty early on in the game, and most of the polymer science departments are as well. I'm not just saying we're the only one, but I like my role and being able to join that history, right, and try and contribute to that for sure.
Yeah, so. We are the only one in Southern Miss, though. So
that's correct.
We've got to put that as a part of recruitment too. That for longer than half of the existence of idea of polymer science. So where were you prior to being an assistant professor at USM? Yeah,
so obviously where I grew up, Bunbury, small sort of country town at the time. No university there, or not a major university to do sort of, I guess to do the chemistry that I wanted to do. So I went to the University of Curtin University, it's called, I'm thinking wrong, to do my undergraduate. I did an undergraduate in the Bachelor of Science with a major in nanotechnology, it was called at the time. So I did a lot of work on not just organic materials, but also inorganic materials and sort of looking at sort of electromagnetism and crystallography and things like that. At the end of that, I actually took a year off. I wasn't sure what I wanted to do after the end of my bachelor's, and I did a diploma of education. So I'm actually a qualified secondary school teacher in science and mathematics. Yeah, so that's a 1 year you can do in Australia. And at that point, I was kind of thinking I might jump into teaching, right? Because I really do love education, was looking at secondary level, like high school teaching. And during that year, a few things happened, but a good friend of mine was in a car accident, and she is now quadriplegic from the injury she sustained in that accident, right? And he was a good friend of mine from high school, and at that point, I started to see some research around sort of neural regeneration and opportunities in nanotechnology for that sort of thing, right? And so that kind of all happened around the same time and made me start looking at sort of graduate school, and found a really good group that was looking at some ways of breaking down glial scar tissue, which is one of the major inhibitors after a traumatic event that stops neurons to be able to regrow and synapses to reconnect following an injury. And so we're looking at ways to target that scar tissue essentially in the brain or in the central nervous system. And so part of me to get inspired to do graduate study was to think about ways I could sort of, contribute to, something I'd seen firsthand, I guess, with a good friend of mine. So that's why I put, going back to education on the back burner at that time. I always tell people that I'd like to think that I could retire as a secondary school teacher, which obviously annoys teachers. And I mean, no disrespect when I say that, but I just think, I'd love to be able to get to that point where I can give back to high school, because that's where I kind of really decided that, okay, chemistry is going to be it for me, right? And so I like that opportunity to have some impact in that sort of age group, that space. And so that's my PhD. So my PhD was at the University of Western Australia. So there's about 4 major universities in Perth, which is the capital city of Western Australia. Curtin University is on the south side of the river, and the University of Western Australia is on the north side of the river. So I crossed the river to do my PhD, worked on a range of different things, looking at polymeric nanoparticles for drug delivery applications. We delivered everything in my PhD, from looking at enzyme stabilization right through to small molecule chemotherapeutics, through to peptides and different biologics. And so got a really good kind of introduction into biology, disease pathology and injury pathology and things like that, and still using polymers as the tool to treat those injuries and diseases. And so, again, I like to tell people this, especially if students are listening, but I had no biology background. So yeah, as an undergrad, had no real formal polymer training and had no biology background, right, at all. Learned all that in my PhD and postdoc. And now I'm trying to lead a group on polymers and bio applications, right? So yeah, I guess you can do whatever you want if you put your mind to it, maybe is the theme there. Yeah. But also, that's the thing about a PhD, is that you don't learn, I mean, you do learn a specific area, but you learn how to learn in a PhD, right? And that's kind of what I took from that experience.
Now, how did playing hockey, and I say hockey because when I learned you played, you referred to it as only hockey, but to all my listeners, we're talking about field hockey. And let me correct myself again. Actually, my co-host, Dr. Alicia Buetes, played field hockey growing up. I'm curious, Alicia, if you just called it hockey also.
Yeah, probably in South Africa, you would think so, right?
Yeah, but Dr. Clemons here was on the Australian national team.
I was, yeah. So I debuted for Australia in 2011 and played right through to 2018, which is when I kind of finished up my fellowship in Australia and came to the US for my postdoc at Northwestern. But so yeah, for my whole PhD career, so I started my PhD in 2011. So for the whole time of PhD and then a 4-year fellowship following that from the National Health and Medical Research Council, kind of like Australia's version of the NIH essentially. Mm-hmm. Yeah, I was playing elite level sport. And I think I was very fortunate that I had a PhD supervisor and a mentor that allowed me to do that, right? And could see the value of that. And he knew that, if I wasn't in the lab doing experiments, it wasn't like I was off, having beers at the pub or, out with friends just, cruising around or not turning up. I was usually either training early in the morning or training in the evening or at a tournament somewhere, right? So, once we had that trust, and he trusted that I was, working when I could and was back when I needed to be. And, also when I was traveling with the team, guys would be off just having coffee or hanging out, and I'd have to be, working on papers or doing reading and stuff like that. But, made it work and very proud of what I was able to do as a hockey player, but also, proud of what I was able to do as a PhD student at the time, for sure.
Tell us a little bit more about what that did for you, how that helped you being able to have this sort of energetic outlet outside of the lab.
Yeah, so I've spoken a lot about this, but I think I was a better scientist and because of my hockey, and I was a better hockey player because of my science. And what I mean by that is my PhD and my postdoctoral work. I was looking at treatments for I guess central nervous system injuries, right, and for cancer treatments and heart disease. And so these things are impactful and meaningful. And whenever you speak to someone has a story connected to those injuries or pathologies. And so it's very easy to see the meaning of what I was doing from my research. And so that meant that if I, missed a selection or had an injury or was out of form, for example, on the hockey pitch, then I could just dive into the lab and get stuck into my research and kind of really immerse myself in something that was still very meaningful and, I had a lot of passion for. And likewise, on the other side, we all know that when you're doing a PhD, a lot of things go wrong, right? You have experiments go wrong, experiments don't work, paper gets rejected, things like that. You ask for some funding, you don't get it. Those things, rejection's part of the game. And so when those things happened, I could go out and just have fun with my mates on the hockey pitch and play hockey again, immerse myself in something that was very meaningful to me. And, I think they balance each other really, really well.
Yeah, yeah. You probably don't get to play too much around here, huh?
Yeah, so actually it leads to the next sort of major transition in our life. But, I retired from international field hockey. We sold a business, finished up a job at one university, moved across the world, started a new job. Totally different climate when you think about Chicago, Illinois, from Perth, Western Australia, and then we had a child. My wife and I had a child within this 6-month kind of window, right? So we had a lot of flux in that time, and I probably didn't give myself, if I think about my first year of my postdoc at Northwestern, didn't give myself enough time to probably adjust to that hole that taking out field hockey kind of left, right? Because you train 8 times a week, for example, with 20 of your mates that you see more times than I'd see my wife some weeks, right? I'd be hanging out with the guys. And so, and you all of a sudden go cold turkey on that, right? No field hockey, stop it. I struggled a little bit in sort of adjusting in that space for sure.
You ever play lacrosse?
Yeah, I read on the website when I was doing my research for this interview that you bring your lacrosse stick to work every day.
You haven't seen me with my lacrosse stick?
I don't know why you bring it. Why
not?
Just in case?
You ever see someone walking around just bouncing a basketball?
No, I do not.
Okay, well that's weird too, I guess. Do
you just like have a ball in there and just like flick it around and stuff?
Yeah, it's for the way I see it is if I'm on the lacrosse field and I have to get from point A to B, it's you can't just walk there. You're right, the stick shakes in a certain way, you have to carry it a certain way. So when I'm walking around, I'm practicing how I cradle the ball.
I like that.
Throw it against the wall here and there. I actually have a specific area that I park because the path to the building.
You get a couple of walls to
There's a couple of good walls. Otherwise, there are some nice spots right here we can see out your window, but there are no walls.
I like that.
No fun on that walk.
I'd love to come out and throw a ball. Yeah, I haven't played much lacrosse, but maybe I'll let you know a little secret too. In my car, I normally have a baseball that I keep on the driver's side door.
Yeah.
Because I get angry at bad drivers, I should say, and it's my stress relief. I sort of pick the baseball bat and I just throw it around in my hand and just like fiddling with it. You know what I mean? As I'm sitting at traffic lights or whatever. But there's something about the leather of baseball and never, not that I played at any level of that, but I do like holding one and just throwing it around and stuff in the car. So you pull up next to me in the traffic lights, sometimes you see me just flipping a baseball around. So
that's
similar to
so whenever you're angry at another driver, you just pick up a baseball.
Yeah, imagine if I get really angry, right?
Yeah, that's what I am imagining right now, actually. Yeah.
No, it's never gone to that. I've still got the exact same baseball I've always had, so I've never lost it out the window.
You have a way to get that out. All right, so you went to Northwestern. Let's get there.
Yeah, so the postdoc at Northwestern, so my fellowship in Australia was finishing up. Fellowship was focused on, we changed tact a little bit, but looking at nanomaterials for wound healing and burn injury sort of treatments. And that was really fascinating to learn a new pathology and a new sort of disease area that I didn't have much background in, but do now. And the Clemons lab is still interested in areas of that from a research standpoint.
And at this point, it wasn't, like you said, you were in nanomaterials then, and that it wasn't. How do I ask this? When you went to Northwestern, you were getting into nanomaterials. Was this when you were like, oh, okay, this is the polymer science now is really, really starting to pick up? Or did that happen with the nanotech?
Yeah, so all our nanoparticles were polymer-based,
Gotcha,
but we'd also incorporate some inorganics like iron oxide and things for imaging contrast and things like that. But by that point, my PhD was all based around making different polymers for drug delivery and things like that. So, yeah, by that stage, I'd kind of realized polymers are pretty cool and want to keep working with them. And then, Northwestern, so I worked with Sam Stoop. He was a fantastic lab, fantastic mentor, and he kind of has pioneered work in this space of peptide amphiphiles or supramolecular polymers. So, you think about polymers, traditional polymers where the monomers are held together by covalent bonds. Supramolecular polymers, they're held together by non-covalent interactions like hydrogen bonding or hydrophobic interactions. And, an area I had no idea about before coming. In fact, I had never made a peptide in my postdoc or my PhD in Australia. And before coming to the Stoop lab, once I'd found out that, okay, I've been accepted, I'm going to come across here, I called a buddy of mine who he worked in a lab at University of New South Wales, so UNSW in Australia out in Sydney. And I said, man, you got to teach me some peptide chemistry. He's like, why is that? I said, I'm going to Sam Stoop's lab and all they do is peptide chemistry, so I got to get some of that under my belt. So I went out and just sort of did a 2-week crash course with him and kind of got some basics before I went across to the US. And had 3 years with Sam Stoop, worked on primarily tissue regeneration applications with these peptide amphiphile sort of materials. And I always tell Sam that it's an amazing place to do research. I used to tell him it's like Disney World for a scientist because in terms of materials, in terms of expertise that are around you, in terms of equipment, things like that, Northwestern was a fantastic place to be.
Yeah.
And to experience that for a couple of years was amazing.
That sounds awesome. Tell us what is a peptide? Why do you have to know how to do peptide chemistry to understand tissue regeneration? Yeah,
so the real nice thing about their peptide amphiphils and the supramolecular polymers we worked on is that they're built primarily just from amino acids pretty much, so peptide bonds between amino acids and lipids essentially to program their self-assembly. And so amino acids are the building blocks of proteins essentially in the body. And so the nice thing about those from a biomaterial standpoint is that they can be degraded back to just lipids and amino acids, which are common to the body and are able to be excreted or repurposed into making more proteins and things like that. So, very biocompatible materials to think about. But, I love the aspect of being able to program these monomers essentially to assemble into a structure that you want. And that sort of ability to make a molecule that can then, on its own self-assemble, right, was fantastic. The other thing I think that's really impressive from peptide amphiphile standpoint is that they can have these material properties like what we see for traditional polymers and hydrogels, for example. But they're very well characterized in the fact that, the monomer, the peptide amphiphial, exactly what that is. You can get a mass spec of it, clean as exactly the molecule you've made, but it assembles to have these macromolecular properties, right? One of the challenges with polymer chemistry is that, the materials you make are inherently often polydispersed, right? And that becomes a problem when you think about...
What do you mean by polydispersed?
So they have, the molecular weight of one polymer chain in a mixture is different to the next polymer chain, different to the next one, right? So it's really hard when you think about calculating the molecular weight of hexane, for example, where you know how to do that. You can take all the carbons, all the protons in there and add them together and get you one molecular weight, right? You can do the same thing for peptide amphiphial molecule as well. But with a polymer, it's difficult to do that because of the way we make these, whether it's with radical initiation or other techniques, for example, that there's inherently going to be dispersity in that molecular weight you get. And that's what we talk about in terms of polydispersity. Mm-hmm. The reason that's important from a bio standpoint is whenever, we're putting things in the body and the FDA, the Food and Drug Administration, that approves and kind of is the checks and balances behind, drugs that are developed and things like that and therapeutic devices. They want to make sure that they can be very confident they know exactly what it is, right? And so polydispersity is a problem when you start thinking about things for FDA clearance and things. So that's why I quite like the peptide amphiphial construct. And I also love that, when I arrived into the group in 2018, that, Sam Stoop by that stage had kind of been working on these things for about 20 years, right? And as a postdoc coming in, you think, they've got this stuff dialed out, right? They know exactly what all these things do and how they assemble and what we can do with them. But there's still so many fundamental questions that needed to be answered and were being worked on, which was just exciting, right? To know that, a space that has many people working on, me being new to the field, could bring in different ideas from polymer chemistry background and kind of try and dovetail in with what they were doing was just an exciting time to be working on it for sure.
You've talked a lot about assembly and self-assembly. I'm really glad you did, because that leads me to this quote I have here where when I pull up your site, your website, which let me Let me read that quickly to the audience, and I'll be sure to link that. ClemonsLab.com. The first thing you see when you pull that up is soft matter science at the interface of synthetic and biological self-assembly.
That's a hot sentence, right? That's good.
Oh, yeah.
That probably took me some time to figure out. Yeah. So.
I know, but you're right. That is a good sentence. And actually, you add here that your primary focus is the integration of polymer chemistry, both covalent and supramolecular, which you've talked about a bit, with biology to provide novel function and therapeutic strategies for the treatment of disease and injury.
Wow.
I like that. Yeah.
I can't believe I wrote that.
Yeah, you didn't pay anybody? That was good.
You told me you were going to talk about grabbing the website, and I was like, I got to get back in there and update that. I haven't been on it for a couple of months.
Clearly it's been a while.
Been busy trying to be an assistant professor. But, the website is a funny story because I want to talk a little bit about that. So when you go out and apply to become an assistant professor, essentially, right? In the US, it's a big beast. It's not the same in Australia, essentially, but it's like draft day, right? If you're an NFL fan or something like that, where, chemistry jobs and chemical engineering jobs and biomedical engineering, they're all kind of coming out at the same sort of time, like August, September, October. Applications due October, November, December, say, with interviews all happening in the new year, essentially. And then, everyone's kind of on that same timescale, right? And so you're out there and you're applying like crazy and you're putting applications out to, different schools and different areas, writing new cover letters, writing new projects, all that sort of stuff. And it's a pretty involved process. But the point of setting the website up, I actually set that up and to have a sort of a web presence for the lab. And the vision for the lab was twofold. One, I wanted that out there, right? It's important to show that, from a branding exercise, this is what we want to do and this is what we're about. But the other part is just diving a little bit into Google Analytics allows you to kind of see where people are looking at your website, right? And so as I was applying for jobs, I didn't, advertise my website, right? I didn't let anyone know that it was out there. But on all of my documents for applications, I put my website on there and stuff, ClemonsLab.com. And I'd be able to watch Google Analytics. And so you could very easily see when, a department in an area or a new city or town was like, oh, there's a few looks over here, right? There's a few people in Hattiesburg, Mississippi interested in your website. So someone's gone to that. So it gave me a little chance to maybe get a heads up on where my application was getting some traction at and where it wasn't.
Yeah, clever. I like that.
So yeah, that's a little gamer there for anyone else that's listening and maybe going on the job market, is that kind of worked out pretty well for me because it wasn't out there, no one else really knew about it except through the job application.
Yeah, so the only people that are going to see it are the ones you've submitted
an application to, right? So
that's a good idea. Not
that it helped me at all, right? I mean,
well, you're here.
I don't know if it helped at all. It maybe just probably made me more anxious through that whole process. But at least I knew that people were looking at it somewhere in some places, right? So it was getting some. So yeah, that was why the website came about. And yeah, I guess do you want to talk a little bit about what we're doing now?
I absolutely do. Well, website aside, I'll ask you, what would you say is the focus of your lab's research right now?
Yeah, so I think from a a single kind of sentence space, and we really love the ability that polymers give us, covalent polymers as we traditionally think about them, and especially controlled radical polymerization allows us to get different architectures of polymers, but just that rapid kind of scalability, cost economics is pretty cheap when you think about polymers compared to other materials. And the material properties you get from covalent polymers are amazing, right? One of the challenges with covalent polymerization still at the moment is how do you go about getting that sort of sequence control, that monomer to monomer kind of control over these systems, and that's quite challenging still. So I like that you think about peptides and what we can do with solid phase peptide synthesis on the other side of this is you can have the ability to make different peptide sequences that can interface really intimately with biology, whether it's for signaling, whether it's for instructing cells to do different things, whether it's for self-assembly, like what we did, when I was in my postdoc in the Stoop lab. And so, taking those two spheres pretty much, the polymer chemistry and controlled radical polymerization and step growth peptide chemistry, for example, and how can we kind of marry those together and get some of the benefits of both of those is kind of, a lot of our projects are spaced in that kind of wedge, I guess, with peptides at one side and polymer at the other. And we have some projects that are totally basic polymer science focused, covalent polymer focused, and some that are fully peptide focused, but the majority sit kind of in that sort of space between those two. I think there's lots of opportunity and to think about how we can make polymers instructed by biology or in the presence of biology and have biomaterials that actually start to hear and listen, I guess, to what's happening around them from a disease state or from a pathology state.
Wait, can expand on that a bit? What do you mean by what you just said, where you're having a disease or virus, something listening to the polymers that we're making?
Yeah, so like if you think about when our body goes through an injury, right? So think about, let's say, stroke, for example, right, or heart disease like a heart attack. Okay, like biochemically, things are changing very rapidly in the body, right? There's ion flux of different metals like calcium, for example. There's pH changes. There's changes in reactive oxygen species, things like that. And all these things we can tap into to either make materials, generate, like so materials build, but also have materials go away or have materials release for therapeutic applications. And so, we're very interested in trying to tap into those things for controlled delivery, but also for tissue regeneration applications as well, and how we can use that to our advantage. And I think some of those things that have been kind of addressed with polymer chemistry, but I also think, if we think about how polymers have been used for disease treatment at the moment, there's kind of two main ways. It's either being used as a carrier or a protector of a therapeutic, a traditional chemotherapeutic, for example. And you have this polymer particle where you end up delivering a whole lot of polymer for a small amount of therapeutic to get to where it needs to go. And that was definitely my PhD, right? I mean, that's what we did. And I always used to be kind of, I guess, annoyed or frustrated with that we had to, maybe the polymer particle from a weight per weight loading percentage, you only have 10 or 15% loading of the actual therapeutic. So lots of polymer going in there for only a small amount of sort of bang for your buck almost, right? And I think there's opportunities to make the polymer become more therapeutic in its action, right? So how do you actually make the polymer be the therapeutic or, be therapeutically active instead of just being the carrier for a known therapeutic, right, or a chemotherapeutic, for example, if we're thinking about cancer.
It seems like I was going through some of the literature that you'd had on your site, and there I found, I hope I can say this right, Proapoptotic.
Proapoptotic, yeah.
Proapoptotic? No, there's definitely something. Proapoptotic. There's an extra OP in there.
No, there's not. Proapoptotic.
I'm Proapoptotic.
Then maybe there's a typo on my website, but yeah.
Oh, it's on the paper.
Proapoptotic.
Okay, well, yeah. I'll accept that it's probably a typo on the paper. But man, I was sitting there for like 5 minutes earlier. Proapoptotic peptide brush polymer nanoparticles. So this seemed like an example of what you were discussing here in this paper. There were micelles being formulated and a specific sequence of peptides attached to the polymer arms here.
Yeah, so that's a great paper to bring up, right? So that was work, and great for a few reasons, right? The first one is so that work was led by Nathan Gianeski and his group, and his postdoc at the time, Hao Sun, who's now an assistant professor at the University of New Haven. And so we both started out in the same year. We were both postdocing at Northwestern at the same time, and the Gianeski lab sat literally the floor below where I sat in the Stoop lab. And so, yeah, Nathan Gianeski is another Australian guy, which is kind of nice. He gave a talk in the first few months that I was at Northwestern. I asked a question at the end of it, and he answered with something like, hey, normally they only let one of us in a room at a time. Like, what are you doing here? And I remember being like, whoa, what's he? He's having a go. This guy's a pretty cool dude, and he's kind of called me out. He had to answer my question, and then we chatted afterwards, and he's been a fantastic kind of mentor of mine, just from a range of different areas, just purely because I'm another Australian in research, polymer research, say, in the US. So I've been very grateful to have that support from him. But this collaboration with Hao as the lead author came from that, right? Just from talking about ideas and can I help, what can I provide, and that's sort of where it came about. That work's really neat. So that works using polymerization-induced self-assembly now. So growing block copolymers, but as that hydrophobic block, so we're talking about a hydrophilic block and a hydrophobic block of a copolymer now. And they can then self-assemble into micelles because the hydrophobic block in an aqueous environment wants to get away from the water and it packs to itself to make the core of the micelle, essentially. Mm-hmm. And so the nice thing about PISA, polymerization-induced self-assembly, is that as that hydrophobic block keeps growing, it then has this critical point where it then forms the micelles. And you can do that and get fairly high solid content, so fairly high concentrations of the nanoparticles in that space, compared to previous approaches where you'd have to make a block copolymer, purify them, have the right solvent exchange systems to then make the micelles, right? So it's kind of a robust technique.
This photopolymerization-induced self-assembly, is this sort of just utilizing phase separation as the polymers come together? So
so exactly. So the thing I like about that paper so much and the work was that twofold. If I go back to my point around making the polymer be more therapeutically active, so in that case, the hydrophilic block actually had a peptide sequence on it that
which I loved. FY,
Proapoptotic.
the KLA. I like to just read it as clack, 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 clack.
Yeah.
I assume that's how you use it in lab.
That's correct. Yeah. The
scientific
KLA
term.
repeat or the clack, clack repeat. Exactly. So that peptide's proapoptotic, so it's known to actually induce cell death, right? And so, but it's very hydrophilic because of all the lysine residues in that, right? So the idea was okay, so we can put that on the hydrophilic block. Then when these self-assemble, we're presenting that peptide out to the cells essentially, right, that we wanted to deliver to. So you're thinking about cancer cell, a cell you want to get rid of, you deliver these nanoparticles, you have high toxicity over the cell population you want. The thing that's really nice about that work is that what they found, and what we found, I should say, is that having that clack-clack peptide presented on the surface of these polymers actually had greater stability because of that covalent polymer there as well against proteases and things that are very good at being in the body at degrading peptides. So, the polymer is now acting as both, the particle, right, the formation of the particle. It's also now protecting the protein or the peptide, I should say, from protease degradation. And also it's having this therapeutic capability because it's actually the hybrid between the peptide and the polymer that's causing the toxicity in the cells that we want. And so you can really see some opportunity in that space to think about adding in maybe more traditional chemotherapeutics into that self-assembly approach. So you could have them being sort of, a double effect of chemotherapeutic being released and the KLA sort of peptide being proapoptotic as well. So, and the other thing that's kind of glossed over as well in all of that is that this was also made in a one-pot synthesis using polymerization in an aqueous buffer, right? So again, going back to that point we kind of opened with about accessibility of controlled radical techniques and keeping that, this is done with LEDs that you brought off of Amazon for $20, right? And doing it in water or an aqueous-based buffer is pretty cool stuff.
That is really cool. I'm looking at, and again, folks, I'll link at the very least the title. I hope you have access. I'm gonna have to figure out how to even add this, but I'm wondering if our listeners actually get access to this paper. Remember, there's a typo in the title. But what made me want to talk about this? I'm looking at. I might as well show you.
Yeah,
right
I bet
here.
say you're talking to me. I'm looking at it. Yeah,
I'm looking at this structure, and it's amazing that this is a one pot synthesis. Like I'm trying to visualize this happening, right? And how do you end up with these core shell micelles? And instead of just, if it's all in one pot, how do you not just get some entangled network?
So that's the nice thing about controlled radical polymerization, right? Is that you can do the polymerization with the peptide monomer, and then we had a co-polymerization with the peptide functionalized, and then just an unfunctionalized monomer here being the dimethacrylamide, right? So the DMA. You can run that to pretty much completion where there's no more vinyl sort of groups in there, right? So there's no more of that monomer left for the hydrophilic block, and then you then add in the hydrophobic monomer to then start that PISA process, right, and grow that off the end. So you do have a true kind of die block copolymer process in that.
That incredibly clever, yeah. So let's go back, turn it back to your lab a bit, and let's say in 5 years, what would you like to have accomplished from your research group?
Good question. Hard hitting. Also, just let the listeners know that the band started practicing on the Oval. So there's a little bit of background noise that you get in the penthouse office up here. Yeah,
I should be able to get that out of there.
So where do I want it to be in 5 years? I think, the thing that draws me to this role is, students, right? And what we're doing with students. So I think the easy answer for me would be, okay, I want to be funded. I want to still be here in 5 years, right?
Sure.
I want to have made tenure, right? I want to be able to keep my job. That's probably the easy answer. But, I think from what am I looking forward to the most is graduating my PhD students out, right? And seeing, and we've got a postdoc in the lab now, and seeing them go off and do great things because, I think that's going to be the real thing that I'll be able to hang my hat on as a professor as I go, hopefully doing this, for a long period of time is seeing where my students get to and what they do and seeing them succeed, right? Because that's the real thing that I enjoy most about this job is just being able to, and I've been fortunate to, I think from going back to the hockey sense, right? I think I probably tapped out my, I wasn't the most talented hockey player, right? But I worked really hard and
you were on the Australian national team.
Yeah,
you were pretty good. Let's say that.
Well, yeah, but I think I think I had to work pretty hard to get there. I don't know if I had much more. You never want to limit yourself, but I don't know if I had a heap of capacity beyond where I got to, right? I think I kind of got most out of that. And I love helping students, especially like realize that there's more potential than what they're giving themselves, right? They might see a limit and then sort of, you can help them blow that limit up and see that they can go higher and further. And I think that's really, really powerful. So 5 years from now, hopefully I've graduated a couple of PhD students by then and they're off doing amazing things in whatever they want to be doing. From a research standpoint, I'm really interested in, like if you think about the body, the human body, the bio-macromolecules that make us up are so important to daily living and what we can do, right? And so, synthetic polymerization has a real role to play in terms of being able to mimic that, be involved in that, and actually contribute to that. And so I really am interested in that interface with how can we make that happen and how synthetic polymerization can play a role in the body and with the body. So,
can you list some of the pie in the sky ideas that type of research contributes to, right? Like things that you might see in a sci-fi movie 50, 100 years from now. Say that happens, you think, hey, I did research that was related to this.
Yeah, I mean, one thing that I'm really, it just got published a few weeks ago, actually. So we had a really nice paper that came out of, the end of my PhD and my, start of my fellowship in Australia, looking at treatments that can reorganize scar tissue, okay? And so, I remember when I started my fellowship looking at burn injuries, we kind of looked at two different areas. We're looking at the acute injury, so how when you get a burn, how can you debride that skin and then treat that injury to repair the skin as quickly as possible? If you can get new cells in there, new tissue quicker, okay, you reduce the amount of scarring and scar tissue you get. So then you reduce the amount of sort of damage that happens longer term from a scar, right? And so we're looking at the acute phase. How can we heal wounds quicker? And then we're also looking at, okay, if you've got an established scar, which has a lot of problems for, aesthetics, but also just functionality, right? The scar tissue in that respect. How can we modulate scar tissue to be more like healthy tissue? And so we started working on some different therapeutics around how can we treat scar and make that to be more like normal tissue. And so I'm really excited about where that work's going. It's just been published, but it's in a clinical trial now and just starting in a clinical trial back in Australia about sort of taking that towards the clinic. And so, for me, working at this interface with materials and bio applications, I just want to see something I've had my hands on and I've worked on, make it that journey, right? And be able to say that, it's actually helping people and I can point to that and say, here's the therapeutic or here's the treatment strategy that I worked on and was a part of, right? And so one that, again, if you think more recently is there's a company that's just being sort of spun out of my postdoctoral time in the Stoop lab, right? And I was very close before taking this job was to join the startup, right, and be a part of that. And they're called Amphix Bio. And so they're doing really, really well with the peptide amplifiers sort of for tissue regeneration applications and starting to attract some funding in that space. And so I'm excited to see where that goes. Even though I'm not a part of it, personally, I know I had my hands on those materials and believe in that technology totally from a tissue regeneration standpoint. And so, that's the end game for me, right? I just want to see it go off and actually help people because, that's our job, right? Our job is to train students, help students realize their capacity and, bring new knowledge to the world and hopefully that new knowledge makes things better for society, right? That's succinctly put.
Admiral, I appreciate that. All right. I just a couple more questions to tie things off here. We're at 4:05. You're doing okay on time?
I'm easy. Yeah, no problem.
All right. You talked earlier about how now you're teaching this polymer organic class, polymer chemistry, but you've never taken a polymer organic class. And it's let me tell you, folks, it's not an easy class. From the student perspective, oh my gosh, one of my least favorite, I'll tell you.
It's got a reputation.
There's a reason I'm a characterization chemist. But now you're teaching this class. So can you talk about how you go into something like that where you've never done this before? And there are other examples that you provided here that really got me thinking on this. You're going into something that you've taught before, but you've never taught this class. You never took this class. Do you have any advice for folks doing something similar? Like a grad school is one thing, right? Usually you come into grad school, you go into a PhD program, and most of what you do, you've never done before. And that's just really hard to do. So any advice on tackling that?
Yeah. So let's go back to the unit first of all. So the unit we teach it's the first kind of polymer organic chemistry unit that our students kind of get, right? Where it's like, okay, now we're making polymers. Here's the mechanisms. Here's how we're doing it, right? And it was daunting for a few reasons. One, because I hadn't taken any. I'd never made step growth polymers in my before starting that, right? In my time. And now I'm teaching, junior undergrads about how to do that, right? So it was definitely daunting. And, what you're really asking about is imposter syndrome, right? How do you feel about that? And that's exactly what I was feeling at the time. Two reasons, because one, It was challenging content. I'd never done it before. 2, this unit has this kind of, I guess, history in the building of kind of being the gatekeeper, right, for our program. You get through this unit in polymer organic chemistry, then you can normally make it all the way through the program, right? And we have a reasonably high fail rate in terms of students coming back and repeating it, for example. And maybe the third element of this was that I took the unit over from, Rob Story, who was, a phenomenal educator, and stalwart of the USM Polymer Science program. And I think he taught this unit prior to me for 26 years straight, right? And so you're like, okay, he's got that dialed in. You know what I mean? He knows what he's doing. And I'm coming in, I'm like, whoa, sorry for you guys, first group in, But I also, on the same breath, kind of relish that challenge a little bit, right? Because, okay, it has this bad history. Okay, what can I do to improve that, right? What can I do to make this more accessible for the students? I love that, I talked about the history of the Polymer Science program. And part of that history is the quality of the students that we put out, right? And the respect they have in academia and in industry. And so part of that is making sure that we have a pretty rigorous curriculum and rigorous program to get students through. And so, I didn't take that role lightly in knowing that this is a kind of high fail class and a challenge for students, but, an important challenge for them to meet and, get past, right? And so, how do I go about that? I mean, I actually have an article, you're on my website before, but, I published a little article about imposter syndrome back in 2020, and feel free, you can get that off the website and have a read. But, one thing I learned about imposter syndrome in all the things I've faced, whether it's been elite sport, whether it's been academia, whether it's been family and challenges in that space, everyone feels it, right? You know what I mean? Every grad students feel it.
For sure.
Assistant professors feel it, you know what I mean? I came here and started a job. You sit down in this office first day, and the first day after all the paperwork and stuff's done, where you sit down and you're like, okay, what do I do now?
Yeah.
You know what I mean? Like, there's no rule book, right? No one's got anything for you to follow. It's like, when you become a dad for the first time, same thing. You get a baby in your hand, you're like, okay.
Now what?
I mean? Like, literally, the nurses pass my orders to me, Tilly, and you're like, okay, here you go, right? You're like, okay, cool. Right? You got to figure it out, you know what I mean? And you have so much more from a parenting point of view, you realize straight away, geez, I was pretty hard on my own parents because they had no idea either. Like, no one told them how to do this, right? And you expect so much from them. So I think the only thing I know about imposter syndrome really is that everyone suffers from it. And, I don't know if it's advice or not, or the way that I've kind of been able to tackle that and get past it sometimes is, I love the challenge, right? And I think I said at the start that I love figuring things out and solving problems, and the bigger the problem, the bigger the opportunity is for the payoff, right? To solve it and get out of it. So, yeah.
Wonderful. Dr. Clemons, unless you've got anything else you might like to add, I think that's a great way to end it.
All right. Thank you so much. No, I appreciate you guys putting this together and taking the time to spend time with me and talk about it. But, yeah.
Absolutely. My pleasure. Thank you so much for talking with me today. And thank you, everyone, for listening to today's episode of the Polymer Science Podcast. If you have any questions for us or maybe for Dr. Clemons, reach out at PolymerSciencePodcast@gmail.com. As always, thanks for listening, and we'll see you next time.
I love how you put your big boy voice on there.